Welcome back to the podcast. I'm so excited for today's episode. I'm literally brimming with joy, which I know just sounds so cheesy, but it's so for real, guys, because I'm interviewing Sarah in this episode. Sarah is one of our brilliant fertility program clients. And after going through multiple pregnancy losses, multiple rounds of unsuccessful IVF, Sarah conceived unassisted. I know, spoiler alert. And I wanted to make sure that her baby girl arrived safely earthside before we actually published this episode to the public. So I can tell you now that baby Amelia is here. And I know sometimes that can feel triggering to hear someone else's success story. So my intention to bring you Sarah's wisdom is to give you a sense for what's possible. She went through so much and she learned so much, and she's going to be sharing so much wisdom about how she moved through these major life events, how she started thinking differently, and what wisdom was available for her in this process that I hope allows you to see and feel and hear what's possible for you too. If at the end of the episode you're feeling like, oh my goodness, yes, I need some of this in my life, we're going to drop the link for booking a discovery call with me in the show notes. So just please know that you are supported here, and I hope you love hearing from Sarah as much as I do. Okay, I am sitting here with this shit-eating grin because I'm with Sarah, who I had to go back in my Instagram messages to find out, when did we first connect? Because it's been a time warp of I don't know, the last 10 years of my life has been a time warp. But I went back, and the first message that we had with each other was September of 2024. So here we are. Yeah, here we are, June 2026. And you are nearly 40 weeks pregnant.
Yes. we're there.
We're so close. We didn't know if this interview would happen today because there could have been a baby born overnight, but we're here. So I trust that whatever wisdom has come from the last almost 2 years, or really over 2 years, considering how long you had been trying to conceive before we met.
Yes.
Where am I going with this? I think I'm just so honored and excited to be with you and have your wisdom shared with other people who may have been struggling or going through similar things, that I'm at a loss for words, and also just feeling really emotional that we're here. She is almost here.
I definitely still have moments of being like, wait, is this real?
Yeah.
Am I the one who's here?
Valid. Yes. So thank you for being here, Sarah. And I know we've recorded just prior to you conceiving her, we recorded, because even at that point of having been through multiple pregnancy losses, there was already a much different experience that you were having prior to September of 2024. So people can always go back to that original recording from last year and learn from that. Because I think we did that one, gosh, it would have been probably about this same time last year, or just before.
I think that's right. And the one thing that I'll mention about that is that I remember that there was, despite, having had a failed transfer, a failed IVF, I felt much more calm and relaxed than I did even a year before that point, where there was just such a sense of urgency and oh my God, I'm running out of time kind of feeling. So that's what I'm remembering right now back from that time.
Yeah. And I know a lot of people can relate to that feeling of running out of time. And even though you know that my belief on age is very different from the Western world of how they talk about age, but just 100%. For the sake of people who may be in the shoes that you were in 2 years ago, what is your technical age at this point?
I was 40 when I conceived this child, and I will be 41 shortly after she's born.
And so that sense of feeling like you're running out of time, especially I think as you like zoom closer and closer to 40, there's like something about that particular milestone
Absolutely.
that's like,
Yeah.
oh, I have to do this before then. Otherwise, like everything falls off the cliff. Just to maybe give like a 2 to 5 minute synopsis, what had you been through prior to conceiving this baby?
So I had 4 pregnancy losses prior to conceiving this child, and 1 IVF transfer that was not successful with a euploid embryo. So it was one of those feelings that I know a lot of people in this space, in this fertility space, can relate to. It's like everything looks fine. What's the problem? We don't know. Unexplained. Which is so much of the space, because there are just a ton of unknowns because of, a lack of real, deep research.
Yes. And because of that, like what do you feel like made the difference for you? Both, we'll start with like emotionally, what allowed you to keep going? Like what allowed you to continue pursuing the dream of having a baby after everything you'd been through?
So, I feel like there was a big spiritual component, which I feel like I might have talked about in our last interview. I have always described myself as a spiritual person, but there were a lot of meditations that we did in the Brilliant Fertility program that I felt like gradually unfolded this sort of faith in like the process and when and how everything would come together in X, Y, or Z way, not in a specific way, just in some unknown way, but just how would it unfold? How would it resolve, including like maybe not, maybe adopting a child, maybe not having a child, like that kind of path was also an option. But like allowing that feeling to be replaced with allowing the feeling of needing a sense of control to be replaced with like peace in the unfolding of the journey and the process. So I feel like that really made a big difference for me.
Yeah. And like that element of releasing control, I think is just, right. Oh my God, it's one of the most human challenges that we have. And I saw a meme today that I was like, oh man, this is so good. And pardon my French, but it was like something to the effect, and I wish I knew who to give it credit to because it was just like one of those random scroll things that pops up. But it was like, be stubborn as fuck about the dream and flexible as fuck about how it comes in.
I love that. Oh my God, I just got goosebumps. I love that so much.
And I feel like this baby is such a perfect embodiment of that, because it's like at the end of the day or at the end of a meditation or something to be like, nope, I still want this. And I don't know how it's going to come in, and I don't know when it's going to come in, but I still feel it so strongly. Mm-hmm. And just like to give listeners like full transparency is like when your cohort of the Brilliant Fertility program started, I had been like, I'd finished my hypnosis and like quantum timeline technique training. And so I was doing like some really deep meditations on my own, and I would get these like pings on things from my clients. And I was like, oh, this is like uncomfortable because is this like a psychic thing? Like, this isn't something I have very specifically trained in. I don't quite know like what I'm doing here. This doesn't feel scientific. And, considering the naturopathic doctor who had referred you to me is she's a very strict scientific doctor. She was like, what are you doing? This is weird. What is this? What is this that you're telling people? Like, how can you tell someone that like you're getting a download that this is going to happen within the year? And I'm like, yeah, I know. And I always give it to people with a grain of salt of like, this is just what I am receiving. If this does not feel true to you, then like, please send it away.
Right.
And so for, the meditations that I was doing for your particular cohort and like for you specifically, there were some things that would always come through really strongly that have been interesting. And it'll be interesting to see how this baby's personality unfolds. But the color purple, especially like things that were like very like feminine, like butterflies, flowers, and just this like very clear message of just keep going, keep following the purple. And I was like, I don't know how to tell this to someone, but like the download I'm getting is just keep following the purple.
That's right.
Crazy.
That's when hearing you say that, that's sort of a perfect way to say, like, to describe the messages that or the sense. I don't want to say messages because that I don't know how it would, but it just sort of the sense that I got. And it just felt in my bones, like even after pregnancy losses and the failed transfer, it felt like those messages were even stronger during those periods. And it just, I'm remembering a time where that definitely would not have felt calming or just at all reassuring. And it just would have been panic and like urgency. So that was nice. That doesn't mean, it wasn't really hard. And
it also doesn't mean that there weren't physical changes that were happening, right? It's not like that was just to say like, there's no treatment plan here.
Right.
And to let that all blow out the window and just fully rely on following this, weird download of purple. It's like, no, there are certainly other things that when someone has had recurrent losses that come to my mind of like, oh, what is happening with the microbiome? What is happening with the immune system? What's happening within the partnership? Because of course the male factor can be involved in like, how do we positively influence these things without this tight sense of needing to control all of it?
Yeah. There to that point, there was definitely a lot of back and forth with my fertility clinic and the reproductive immunologist, and a lot of trying to focus on physical testing that we could do that might, give some version of explained rather than unexplained infertility. So yeah, definitely multifactorial.
Yes. For the people who have been through the failed IVF and wondering like, gosh, is this even possible? Would you mind sharing like the circumstances under which this pregnancy was actually able to occur?
Yes. And it's just such a crazy story. So I'll try and, so first of all, going back to the age piece, so I turned 40 in the year 2025. But from the start of the year 2025, I conceived 3 times total. And I really, in my gut, feel like front loading my day with protein had a ton to do with that. And I know I've shared that with you. Regardless, 2 of them obviously didn't stick. And one of them was a failed, well, I'm not counting the failed transfer. 2 of them didn't stick. One of them did, which is this baby. But yeah, just being able to say I became pregnant 3 times around my 40th birthday, like something's working, something in, the diet, the mental, all that good stuff. So that's the first thing I want to say. And after the failed transfer, which would have been around April, the very next cycle at home was one of the conceptions. And there was a ton of angst. I was watching the pregnancy tests and really, really wondering about the HCG and, kind of stressing. And I know that you got a lot of panic texts from me, like, do we monitor this? Do we not monitor this? Like, what feels the best? And once I found out that, didn't seem like a viable pregnancy, we, really dove into, it's been so long at this point that I'm remembering all the technical terms that I was once so familiar with, but like endometritis was one of the big things that we wanted some information on. And I also wanted to test my BCL6 to see if there might be some correlation between that and endometriosis. And so I scheduled some biopsies, and I was at the same time working with a reproductive immunologist that was asking about, how my insulin sensitivity was and like, different clotting factors. And did I have anything else in my history that might, explain this? And at that same time, Dr. Rose had suggested a drug, low-dose naltrexone, which can be used in low doses. It's not its intended prescription, but it can be used as an immune system modulator. And if there was some kind of an immune factor going on, which we weren't sure, the only evidence we had that might be the case is all of these losses, these 4 losses. So one of which didn't stick, and we knew was euploid. And it was such a hard thing because there was all this testing going on, and we wanted to have a blank slate, unaffected by any medication, to know our true baseline. But the opposite argument was, if it helps, what does it matter what the what the starting baseline was? And there was another fertility clinic that I had a consult with that said, I don't think it would be a problem to try this. And so I started trying I started taking it just to get it in my system. And at that point, I had my biopsy for endometriosis and endometritis. And they put me on an antibiotic to treat something that they found, and they scheduled me for a repeat biopsy. So at this point, I was no longer trying, to conceive on my own. It came time for me to go in for my repeat biopsy, and I didn't think there was a chance that I could have conceived because tracking my cycle, I was pretty much outside of my window, but I was like, there's a small chance I should take a pregnancy test. And I did, and it was negative. And my fertility clinic also tested me, and it was negative. And we went ahead and did the biopsy. And I was waiting for my period to start so I could start the next. I think we were going to do the suppression of endometriosis medication.
Yeah, we're kind of dancing between, like, was it going to be the Lupron, or I'm also blanking on what the other option
Oh my
was.
God.
Yeah.
If it's any indication of how much in my vocabulary that was like last fall, and how much it's just like, there's so many other things to think about now that I'm like, wait, what was that word again? Yes, I was waiting for my period to start because I was going to try Lupron before my next transfer. And I was waiting. And I was waiting, and I wasn't even thinking that there was a possibility that I was pregnant. And I was technically late. And I remember that I was at my sister's, and I was driving home from her house, and I was like, there's no way. And I decided that I was going to take a test when I got home, and I did. And we had already passed, at this point in my cycle, I had already passed the point where I would have been agonizing over faint lines, because it was that period of time had passed without me even thinking I was pregnant or a possibility of being pregnant. So there was a strong positive right away. And I was like, what the hell? Where did this come from? And I was like, I had a biopsy last week. Like, what the hell? So made, called my fertility clinic. Thankfully, they're there to monitor you, whether or not they're responsible for the pregnancy. And I went in at, I guess it would have been about 6 weeks. And they said, we don't expect to see a heartbeat today, but just, to confirm the placement of the pregnancy. And for the first time in my whole life, there was a little flicker at 6 weeks. And I was like, oh my God. And then there was definitely, how could there not be nerves with my history? So the next time I went in would have been 8 weeks. I had been having some symptoms. I went in, I was so nervous. And this pregnancy at 8 weeks looked so different visually on the ultrasound screen than I had ever seen. In my previous pregnancies, there had only ever been a gestational sac and a yolk sac, when there should have been something that looked like what I was seeing in that moment. I was like, oh, so that's what it's supposed to look like at 8 weeks. And my doctor was so funny. He was like, yep, we're having a baby. And I just started crying on the table. And he was like, what's going on? Like, whoa. And I was like, no, you don't understand. My husband was actually there with me. He was like, it's just a little bit of a moment. Like, we're sorry. But yeah. And from there, it was just like, this is a baby. Like, and I did spend so much time like being in the moment with this pregnancy, which, sounds like a good thing, but I was kind of watching, like, there's a little bit of being influenced by my past, but like, just being cautious but, there are definitely people who, think about buying strollers and getting a doula when they're, 10 weeks. And I was just, into the second and even third trimester, I was just being in the moment. And now finally I'm like, okay, wait, what do I need?
Wait, like, we might have a baby this week. Should we get something?
Right.
I just want to really validate how normal that is for anyone who's experienced a loss to have the tools to stay present, but also there's like a level of protection that you're providing for yourself 100%. In doing so. And it's very natural to have that response.
If I have one message for anyone, I don't know what your answer is, but I can't not put a ton of stock in this presence of the low dose naltrexone being, like the obvious different, factor in, this, my whole history, if that makes sense. And just really thinking that it made a huge difference for me. And yeah, there's no way to test it and know for sure, but it's just this thinking outside the box, this following your gut, this, maybe give this a shot. Whatever your version of that might be.
Yeah.
And that's all thanks to you.
Oh, well, I will receive that, but also knowing that like this baby would have figured out her way here to you is what I firmly believe. And also, like, who am I not to suggest a tool that wouldn't be helpful? And when it comes to low dose naltrexone having such a high safety index,
right?
It's like, to me, it did feel like, hey, this is worth the discussion with your REs. And unfortunately, there are some who still just have no experience with it or are unwilling to even look at the data that we do have on it, even though a lot of that data is anecdotal and it's so challenging to study things in pregnancy, but in the preconception phase or with people who have had multiple pregnancy losses, like we just don't have much to go on. And so if we can use something that's generally speaking safe, isn't going to hurt, we're still kind of on the fence of like, could this help everyone? Maybe not. But like there are definitely clues in the history that we can use to put the puzzle pieces together.
Yeah, yeah. Like if you're familiar with, the ways that a lot of REIs operate, there's no large-scale studies to support X, Y, and Z, supplement or drug or whatever it is. They're just going to say, this is against our recommendations. And they're not, they're you can find those out there that it's where it's a little bit more of a heart feeling thing. Like this person is really struggling. I've read this, and this thing. I really feel like I might suggest this to that person. But as a general rule, REIs don't operate that way.
Yeah. And where I think it's particularly challenging is with women who are over 35. There's like an automatic assumption that if they've had multiple losses and it is the kind of like unexplained, it's like, well, the most likely is that it was, some abnormality of the embryo, some genetic factor, chromosomal factor, and low dose naltrexone isn't going to help that. So if they're coming at it from the assumption of like, well, now we have to go through IVF so that we can test these embryos. I think for me, we're like really locked in as there's something else going on here, is to have a euploid embryo, like an embryo that, made it through IVF with positive genetic screening, also not result in, a pregnancy that lasted. Was like, that was for me like, okay, we got to look at something else, guys. Like, what are we doing here?
Yeah. Yeah. And you might, you get REIs that will say, the chromosomal testing is not perfect. There could still be something.
And this is true.
We'll explain, which absolutely. Another thing for me that was I think a gut instinct, like gut feeling influencer was the euploid rate that we did get. It wasn't amazing, but I didn't think that the chances were that every spontaneous conception that I had was could have been explained by a chromosomal abnormality, if that makes sense.
And it's hard because we will never know on paper, right? We'll never have that lab test that we can see with our own eyes and make logic out of with our brain in the way that part of ourselves wants to have locked in. And that is why I think the mental, emotional, spiritual tools are critical.
Mm-hmm. Yeah.
I always like to ask this when people are sort of at this verge of the threshold.
Yeah.
Of this baby actually being earthside with you. Is there any advice that you would have for yourself 3 years ago?
Oh God, that's so hard. I shudder to say this because it sounds very similar to just relax, which everyone has like an allergic reaction to, rightly so, as they should. But I wouldn't want Sarah of 3 years ago to just take some deep breaths and try to be in the moment. I think that would be a good thing for her to hear. I don't know how she would have received that info. Like, no, but wait, if I just read this more, like, if I just do this extra research, that might help. Which there's a lot to be said about that, because I was definitely, feel like I doing a lot of legwork when it came to, okay, what do I want to try to explore here? What is my gut telling me? Like, what can I communicate with my, my REI about? What can I ask about? But yeah, just take some deep breaths and just be present.
I think that is hard because in some ways, like that version of you from 3 years ago who was deep in research mode, who very much focused on doing it perfectly, doing it right, getting the right answer, like that still led you here.
Mm-hmm. Yeah.
So I think there's so much gratitude that we can have for her and all the legwork she did.
Yeah.
And then also the learning of the tools, learning how to practice surrendering and knowing that, oh, I don't even have to get surrendering perfect. I can just keep practicing is
right.
That's kind of the name of the game, unfortunately.
I'm not anxious person. Anxiety will always be a part of me and a part of who I am. And I think that there are countless times in my life where if I could have been reassured that in 1 year or in 3 months or in 4 years or however long the time period and whatever we were talking about, like everything's going to work out so you don't have to stress about this. Like that would be so amazing, but it's just not how life works. And to know that somehow it usually comes together is like just a good thing to remember.
Well, I hope you carry that forward as a little reminder for everything else that happens in life, since you've got a ways to go.
Yeah. That's I'm going to try to remember myself saying this right now at this moment.
Well, it's recorded, so thankfully you can come back to it. We can cut that little snippet out and just have it as like a little quick access.
Perfect. I love it.
Well, thank you, Sarah, for sharing all of it, the ups and the downs and the where are you now. And
of course,
I feel so lucky to get to work with wonderful people like you.
I also want to add, like, if anyone has any questions or just needs any, like, please reach out to me, find me. Like, I would love to talk to you. It's just, I don't even know what it is you might need, but if you feel like, that would be helpful in some way, like, absolutely, because I would be happy to, just listen or share anything, like whatever it is. I don't even know what it might be, but I'm here.
And that's so beautiful because I think there's an element that a lot of people hit at some point in their fertility journey of loneliness and isolation and feeling like no one has ever been where I am, or I will never get out of this. I will never get to the other side of this. Like, there's no way this is going to be okay. It's not okay. And all of those feelings are really valid. But to be kind of where we are at this point in time where we don't have the community, we don't sit in circle with women. We don't have this like relationship to elders and like gathering the wisdom from the people who have been down that path ahead of us. Like, we need that. So thank you for offering that. And any of you who are listening, if you do want to connect to Sarah, just reach out to me. You can email me and I'll connect you guys.
Please do. Yeah. It feels so surreal and I almost don't believe it sometimes, to be where I am right now. It's still a huge part of who I am and my identity, all the things that I went through to get to this point, and it's just, I have this sort of like, wait, is it me? Is it really? Is it really me? And I'm so cognizant of the time when I thought that it wouldn't be. I was sure that it wouldn't be. Ever.
And it's hard. There's no guarantees. I always lead with that when I have my first meeting with someone of like, if there were no guarantees, which there aren't, what would need to be true a year from now for us to look back and say like, this was really worth doing the work.
Perfectly said. Yeah.
Yeah. I wish we could have some magic wand of guarantees for this, but also like who you have become, the decisions that you had to make, the type of work that you have to do to find those pockets of peace and being able to breathe and just be here in the moment. It's like, that's also really powerful and beautiful. And to see that unfold in you over the last almost 2 years, while also being able to witness the anxious parts and be able to hold them with compassion and humor. It's like, God, it's all just human.
Yeah, that's so right.
Well, thank you so much. I know that I was so lucky that I got to see you in person.
Yes,
about 6 weeks ago. I actually got to like see this gorgeous baby bump and meet up with one of our other. Can I get a bump shot?
Yes, absolutely, absolutely. Half the time her butt is like up in my rib cage, and so I feel like sitting up straight is like, oh, okay, we'll recline a little bit. But
it was so cool to actually get to see you in person after being on Zoom for so long and meet one of our other BFP babies in person who was quite fresh to the world.
Well, so cool.
That was like a top lifetime, like, I don't want to say achievement, but that was just like a beautiful moment of like, okay, this is
yeah.
So I'm so glad that I got to hug you in person, and I wish I could hug you now. And I'm sending lots your way for how it unfolds over the next few days, since it's probably a matter of about 5 days before she arrives.
Yeah,
which is wild. So I will just be sending you so much goodness.
Received, and I will be continuing to receive. Thank you so much. Thank you.
You're so welcome.